Hi YouTube world, this is me, Joanna. I know I haven't been on here for a few days, but I just thought I would do an update on my week. It's been a long, eventful week. I got overwhelmed by my depression and anxiety. I know, you guys can think what you want of me, but I have a little boy, and I decided it was best for me to check into the psych unit, which doesn't mean that I'm mentally freaky or that I'm a mental patient, or, I mean, I am a mental patient, but it doesn't mean that I'm psychotic. Um, yeah, let's get that out of the way first. Um, I got medication for my depression. I was taking the lorazepam, I believe it was, for anxiety, and that drug, I'm not a doctor, so don't take any of my word, wrong, but that drug is very addictive, so my doctor didn't want me on that drug because, well, I guess it was because if I quit taking it right now, I'm going to end up having a seizure. So if I just cold turkey just stop taking lorazepam, I would end up having a seizure. But yeah, so I'm not a doctor, so please, I mean, if your doctor prescribes that to you and he feels good about it, I mean, they have their reasons, but that's how my doctor felt. Also, I am taking some antidepressants, and I am taking some things to be able to sleep and some things for anxiety, which helped. I got a big shocker. Well, it wasn't really a big shocker, but something I didn't expect in the hospital. I told him about my gallbladder, and I told him about how I just felt different after my gallbladder surgery. It was in December, and I felt like depressed, tired. I felt like the minute I got out of surgery, I was doomed pretty much, and I kept on going for 5 months. I mean, that's a long time to keep going on a really, really, really bad anxiety. So I discussed that with my doctor, and so he drew blood, and he took tons and tons of tests. Like, he took like 7 vials. He checked for my hormones, and, well, the main thing that he was checking for, he said that he thought I was vitamin D deficient, because I stopped being able to, I was just depressed. I've been overweight, no matter what diet I get on, even the pills, if I get on pills, if I exercise, I can't lose weight, you guys. It's really hard. I've lost a little weight since being on the gluten-free diet, but most people that are celiac disease and they get on that diet, well, I can't say most, but I've heard of people and they quit eating wheat and what they're allergic to, and they drop 40 pounds or 30 pounds. Everybody's different. I'm not saying everybody is going to drop 30 or 40 pounds. But, I dropped about 15. I mean, that's pretty good. But it's just, my body hasn't changed as much as I thought it should. I'm thinking, why am I still depressed? Why am I still tired? I thought, changing my diet would help me. I thought that, doing other things would help me. Didn't help. I just felt more depressed because I couldn't eat wheat. I'm more depressed because I couldn't have gluten. And there are things that I can't eat. I can have gluten-free, whatever. But it was just depressing for me. It was overwhelming. I finally had it, and yeah. But he said my vitamin D is really low. He says that people that, I'm not going to say what state I live. I'm sure maybe I mentioned it. I don't know. But in the state that I live in, there's winter. There's a lot of snow, so we don't get very much sun out. And I hardly drink milk. I hate milk, actually. So that's probably another reason why I'm so vitamin D deficient. But when he saw my labs, he said I had the lowest vitamin D that he'd ever seen in a person my age. He said I had the kind of low vitamin D as somebody in a nursing home, a 90-year-old woman that's really, really tired all the time, and, you know, and that's what he would expect to see in an 80 or 90-year-old, not in me. So, yeah, I thought that was interesting. I'm like, wow. I mean, that's just crazy. Um, been really tired since I got home. All the medications that they're giving me, I think it's just kind of making me really tired. Oh, excuse me. I was I started taking the vitamin D, 2,000 milligrams a day, and I also take vitamin C because vitamin C is very good with vitamin D. So, I'm not a doctor, you guys, but I mean, when you go in for your labs, or if you guys have problems, I mean, there could be a chance if you guys are really tired, depressed, you guys just feel like you can't, you're just so exhausted all the time, and, it could be a vitamin D deficiency. I'm not saying it is or isn't because I'm not a doctor, and yeah. But that's my week pretty much. I mean, it's not everything that I went through, obviously. I learned that I have a lot of healing to do. And some of that stuff is personal, but like from what my ex did, my baby's dad, I have a lot of PTSD to get over. Gotta get over that before I feel that I can effectively date. Sorry, I look so tired, you guys. I am way tired, so I'm gonna go. But I just thought I would do this update for you guys. I look drunk almost. I'm not. I promise. I'm just exhausted. My whole body feels like it's changing, which is good. It's a good thing. Change is good, you guys. It's when it gets out of control and it's bad and you guys stay the same, and you're in a bad situation and you stay there. That's when it's bad. But if you're tired because you're, well, I'm not saying it's a good thing that you're tired, but, I mean, it's probably all the drugs and, all the medication that I'm taking, and it's probably because, I've been processing a lot. Woo! So, yeah. Sorry, my eyes are really tired. I'm gonna be taking a nap. Whew. But I just want you guys all to know that I am doing great. If you guys need to talk to anyone, message me. If you guys are in a bad situation and you guys feel like you are giving up hope, get help. Please. Please, 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 please. I'm gonna do an update on, I'm not sure. It's kind of personal, but I think I need to share. I'm gonna do an update on why I decided to go to hospital in the first place. I mean, it wasn't entirely my decision, but why I was glad to be there. So, and why it's not as bad as it seems like it would be. So, you guys, judge me how you want. That's up to you. But I do want everyone to know, if you're depressed, if you have anxiety, you're not alone. There's a lot of people that are going through there, and there are a lot of people that are in the same, well, they're not the same situation as you are, but they can relate to you. I'm going to do a video about that. A few things that I learned there when I was there. So, I will see you guys all later. I'm probably going to upload this. It's just because of the time. I'm going to do a part 2 of this, okay? Alrighty, thank you.